As on our side, at the Africa continent, we are the last continent to be hit by this pandemic. But from the beginning, when this COVID-19 started in China, we were following up as a department responsible or mandated on health issues in Africa, and also our technical institution, the Africa Center for Disease Control and Prevention, was alerted early since January. What we did, Mr. Masoud, is in February, when the first case happened in Cairo, in Egypt, that's when we said, okay, we need to convene quickly the ministers of health of Africa in an emergency meeting. And that's what we did. On the 22nd of February, we convened an emergency ministers of health meeting here in Addis Ababa, and we requested the attendance of the Director General of WHO, Dr. Tedros. He participated from Geneva through VTC, and our chair of the Union, the African Union Commission, also participated in the meeting. In that meeting, we prepared the draft for the joint continental strategy on COVID-19 for Africa. We presented the strategy to the ministers. The attendance was very good, and it was a short notice, but because people from the beginning, they felt that there is a crisis coming, so they need to be prepared quickly. The strategy was adopted by the ministerial meeting, and then later we took it to the heads of states and governments in their Bureau of the Assembly meeting, chaired by the chair of the Union to this year, which is President Ramaphosa of South Africa. They endorsed the strategy. So what I want to say at this point, that Africa from the beginning decided on acting as one continent, in solidarity, in unity. And for me, this is part of the strength of the response we are doing now in Africa. That the heads of states and governments, they decided that Africa will be led by the African Union Commission in the response, and they will be led technically by Africa CDC. This is a decision made since the 26th of March, when the heads of states convened the Bureau of the Assembly meeting. So we had our clear vision put in this strategy. We have the endorsement of the heads of state and government. That means the political will was very clear from the beginning. And the meeting from the beginning also asked us to establish mechanisms for implementation. Because the implementation is not only on the national level, so the ministers, they will take the strategy and they will align national strategies. No, it's not only that. Because the response is agreed upon to be on the continental level, they created three main committees. A committee from the ministers of health, a committee from the ministers of finance, and the third committee from the ministers responsible on transportation and aviation. Because one of the first measures being taken everywhere, not only in Africa, is the shutdown of the airports and the lockdown. And so we needed these ministers responsible about transportation to be from the beginning with us. The three committees were established, and we brought in the RECs, the regional economic communities. The executive secretaries of the 8 RECs identified by the African Union are members of these committees. So we brought the regional level with the continental level, and then we have the ministerial level representing the representatives coming from the national level. This is the mechanism on how are we dealing with this COVID-19, what the strategy and the mechanisms we are using. Let me add to that, the president of South Africa, as a president or a chair of the union for 2020, he appointed 5 special envoys. 4 of them are former ministers of finance, very well-known Africans. Now most of them, they are working in the international community. And let me name here Madame Ngozi, because she's the chair of board of Gavi. She's one of the 5 special envoys. These 5 envoys, they have been mandated on two things. First, they asked them to go and look into the issue of the economic impact, the cancelling of the debts on the poor countries, putting moratorium on the payment of the interest to deal with the economic crisis that's coming with this pandemic. But also they have been mandated to generate and to mobilize resources for the fund. Because also we have been instructed from the Bureau of the Assembly to establish a fund, anti-COVID-19 response fund. Because finance and budgets is one of the main challenges we have here in Africa. Because if Africa CDC wants to act and to lead the continent in this fight against COVID-19, we need resources. With the resources we have internally, it's not enough. It will not enable us to support the member states. So the first decision they made after putting the structures is to establish a fund. I can tell you today this fund is established. The board of trustees, the members were chosen and appointed. We have elected the chair and the vice chair. We had 2 meetings of the board. Member states, they made pledges to the fund. The total figure is $61.5 million. This money is a seed money for the fund and also for the support for Africa CDC. So they show their seriousness, the heads of state, because these pledges were made in the meeting of the Bureau of the Assembly. And as I mentioned, they had convened 4 meetings since they started. And there is a meeting for the Executive Council, there is meeting. So they put money in the fund. The fund is now established. The fund is open for all our private sector, because the private sector is also represented in the fund, because we engage the private sector also from the first week of dealing with this crisis. We brought in the private sector, we had conversations with the private sector, and they are represented with 3 seats in the fund, in the board of trustees. So I don't want to take a long time in giving the details, but I can assure you that there is a leadership now in Africa. We have learned the lesson from the Ebola that happened in West Africa between 2014 and 2016, because at that time, the lesson learned that Africa has no technical body to lead on the fight against any epidemics in the continent. And that's why after that, they accelerated, the heads of states and government, they accelerated the processes of establishing the Africa CDC. The Africa CDC now is leading this fight. Our strengths at Africa CDC is being tested in the Ebola outbreak in DRC in 2018 and 2019, but this one is a big test for us. But my belief with what we are doing now, having leadership, having looked into the issue of mechanisms, looked into the issue of the funds and the financial resources, I believe we are on the right track as Africa. Today, I'm speaking to you in this meeting. The number of the cases we have in the continent is 66,000 cases. The number or the death toll is 2,300 in the continent. The number of the recoveries is 23,000 plus. We are looking around us, we are learning lessons from the rest of the world. We are also seeking the help and the support of our partners. And maybe you already know that we are receiving in-kind supports from Jack Ma Alibaba Foundation. We are receiving support from some of the Gulf countries. We are receiving financial support from our partners, Bill and Melinda Gates. A lot of partners, I don't want to name names, but let me end by saying that whatever we are doing it in full partnership with WHO. We are working very closely with WHO as a global health custodian. We are engaging them. We have a technical task force that meets twice a week under the supervision of the director of Africa CDC. We have all the technical level representatives from the 55 member states. And they are the one who are coordinating all what we are doing, whether in the issue of pool procurement of the resources and medical commodities for Africa, or the issue of sending responders and volunteers to support our member states. So in brief, this is what we are doing, and maybe later I can elaborate more on the areas we did support already our member states, like the area of diagnostics and building the technical capacity of our lab technicians in the continent, what we are doing, the online training we are doing for the physicians, and for contact tracing. All these issues, maybe later I can elaborate more. But it's just a brief introduction on what we are doing in Africa.